Joining us now, as promised, Dr. Anthony Fauci. Doctor, good morning to you.
Good morning.
I do want to talk about this Delta variant. We do know that it is more contagious, potentially more severe. It has doubled in just the last week. And according to research quoted in the Wall Street Journal, it is spreading so rapidly it could become the dominant strain in 2 to 3 weeks. We knew it was fast. Did you know it was this fast?
Well, we know that from the experience that our colleagues in the UK have gone, because it just exploded in the UK. It went from a minor variant to now more than 90% of the isolates in the UK. So given the doubling time of approximately 2 weeks, right now it's at 20%, Savannah, of our isolates. So you would expect just the doubling time, in several weeks to a month or so, it's going to be quite dominant. That's the sobering news. The news that's so important, Savannah, is that the vaccines that we have now that we're distributing, that we've done so well in distributing, you heard the numbers from your own reporter that, over 65% of the adult population has received at least one dose, particularly the elderly individuals, where 85% of them have received it. So we're doing very well with a vaccine that does quite well against this problematic variant. It's the unvaccinated people that we're concerned about. You gave the numbers. There are some states that are less than 50%.
How do you explain that?
We've got to get younger people, particularly 18 to 26. Well, it's very difficult. We're beyond, Savannah, the larger mass vaccination program. Right now, it's got to be in the trenches, getting people. Like, for example, I was on a conference of mayors yesterday talking about going door to door, like I did with Mayor Bowser just this weekend in the District of Columbia, getting people out, answering their questions. Many people just need more information. They've let it go. They haven't paid attention to it. They have to start paying attention to it now, because if they are unvaccinated, they are at risk. Whereas those who are vaccinated can have a great 4th of July. I mean, you could just do all the things you want to do on the 4th of July if, in fact, you're vaccinated.
Well, and you don't want to overstate it, but a World Health official said the Delta strain is faster, fitter, and will move through communities more efficiently and pick off the unvaccinated. We just talked about those who are unvaccinated for whatever reason, convenience, fear, politics, who knows. I think about the unvaccinated, and I think about a whole group of little kids under 12 who have no choice. They're unvaccinated. And now this more virulent strain is moving through communities. As a parent, what do you advise?
Yeah. Well, certainly, if a child is unvaccinated, which it might be merely on the basis of their age, you've got to be careful and abide by the public health recommendations, which means when children are interacting with others outside of the family setting, if a family members are vaccinated, no problem. When you go out, wear a mask. But Savannah, if you just think about it, the best way to protect the children is to bring the level of virus circulation in the community down. The best way to do that is that those, i.e. adults, who are eligible for vaccination, to get vaccinated. So you're not only protecting yourself, but by bringing the level of virus down in the community, you're indirectly protecting the children who can't yet get vaccinated. That's one of the most important ways to do that.
We were talking about the goal of at least 70% of Americans with at least one shot by July 4th. The White House says, OK, we're not going to reach that goal. We'll be close, but we won't reach it. Have you asked yourselves, those who came up with that goal and thought it was doable, what went wrong? Why wasn't it reached?
I don't think something actually went wrong. That was always, Savannah, an aspirational goal. It was never the goal line or the end game. We wanted to and will go well beyond that as we get past the 4th of July into the summer. So I think we better be careful. We shouldn't say, well, you didn't reach this number on this date, therefore it's failed. Not at all. We were going to go beyond the 4th of July anyway. All we need to do now is, put a full court press on, get to the local people, get the trusted messengers, and get those people who've been recalcitrant vaccinated. So I don't really feel that badly about not particularly reaching a specific number, because we wanted to go well beyond that number anyway.
In the few seconds we have left, just a word about how these variants work. The more they're out there, it seems to me, they get better. They get stronger, they get more efficient, they get faster, they get more contagious. So the more they're circulating around and more mutations happen, potentially, do we then have the possibility of a variant developing that doesn't that is impervious to our vaccines, that could defeat our vaccines?
You said it, Savannah. You're absolutely correct. Another important reason why we've got to get vaccinated. Viruses don't mutate if they don't replicate. If you give them the opportunity to replicate by allowing them from spreading from person to person, you're giving them a perfect opportunity to mutate even more and perhaps evade the vaccine. Yet again, another powerful reason why we should be getting vaccinated.
All right. Dr. Fauci, as always, thank you for your time. Appreciate it.
Thank you, Savannah. Good to be with you.
Thanks.
Hey, thanks for watching our YouTube channel. Find your favorite recipes, celebrity interviews, uplifting stories, shop our favorite deals, and so much more with the Today app. Download it now.